Welcome, hotshots, to Flashlight by Firepower X. Here you can find the industrial strength tools you need to dominate your personal and professional wellness as a firefighter. My name is Jess. I am boss lady here at Firepower X, former firefighter and your host for today's webinar. And I am super stoked to introduce today's guest. Dr. Andrea Nied, PT, DPT, has been a doctor of physical therapy in Colorado since 2011 and owns Movement Physio and Wellness in Arvada. She has extensive experience working with all orthopedic conditions and pelvic floor health for women and men. And her two children ignited her passion for pelvic floor health after she experienced her own postpartum issues. Welcome, Dr. Andrea. We're so excited to have you on the show today. Thank you for joining us.
Yes, thank you so much for having me. I'm really excited just to chat with you and get this word out to the world.
Yes, yes. This is a topic that we don't very commonly hear associated is pelvic floor health and firefighters. So I'm really excited to kind of bring some awareness today with you to the topic and dive more into that and what it all entails. And I wanted to start with a game. So I hope you're ready for my Mythbusters game. I would love for you to either claim as fact or bust as myth some of the thoughts that I had about pelvic floor health so that we can just get them on the table. So are you ready?
Let's do it.
All right, awesome. So myth or fact? If there's a pelvic floor, there's also a pelvic ceiling.
Ooh, no one's ever said that to me before. You know what? If you could consider the diaphragm the pelvic ceiling, actually, which is right under your rib cage.
Oh, okay.
So I don't, that's an interesting one. I've actually never had someone ask me if there's a pelvic ceiling. But this is all your abdomen, is your pelvis to your diaphragm. I work on the whole thing. So I would call the diaphragm your pelvic ceiling.
Okay.
Yes.
So yes. So we call it fact or myth.
Consider that. Yeah.
Okay.
I would consider that fact.
Okay, great. Fact number one. Number two, the only people who really need to worry about pelvic floor health are women who've had babies. Myth or fact?
Big old myth. Yep. Everybody that is a human person has a pelvic floor.
Good to know. And that's why we're going to dig into a little bit deeper today.
Yes.
Number three, myth or fact, we naturally lose muscle tone in our pelvic floor as we age.
Ooh, as we age, I would say that is a fact. That's just kind of a fact in general as aging processes happen in any muscle in the body. So yeah, unfortunately, as we age, we can lose muscle tone. Yep.
Interesting. So number four, myth or fact, pelvic floor physical therapy is a very hands-off experience.
Oh gosh, it's like it depends. That's a hard one too. How I practice is using hands-on technique with movement. The name of my business is Movement Physio and Wellness. So we need both to have really optimal results. So maybe starting with some hands-on techniques just to calm down pain response, calm down the nervous system, and then build that person back up with movement and exercise. So not just one approach.
It's straddling myth and fact, really depends on each case.
It depends.
Okay. And number five, the last one, the only way to strengthen the pelvic floor is with Kegels. Myth or fact?
That is a big myth. There are lots of ways to strengthen the pelvic floor, and I will just quickly say too, is most people think they're really weak in their pelvic floor when they're actually very tight. And you can be tight and weak.
Really?
Yes.
So what's the difference between those strength and tightness? Can we unpack that a little bit?
Yes. So let's unpack that. And I have some models too, if you want me to kind of like bring out a model that might help.
Sure.
Yeah. So here's a pelvis. So
Mhm,
this is the female model. So for you guys out there, I'll just put my finger over that. So just
mhm.
pretend it's a male too. So pelvis, right? Two pelvis bones, your spine, your sacrum, and your tailbone here.
Mhm,
The pelvic floor is like a little trampoline in your body when you move. You need to be able to have that stretch to absorb pressure with maybe like running or jumping or just walking and moving in general. There's a little bit of a give and bounce that needs to happen with that.
mhm,
Um, what we see quite often is people come in and they're like, my pelvic floor is, I think it's weak, like, I'm having urinary issues, like I'm having all sorts of pain, there's a weakness issue. And I'm like, okay, well, let's talk about it. So quite often this trampoline thing is too tight and we don't have the ability to generate enough force if it's too tight. So another good analogy is like your biceps muscle, right? And your elbow joint needs to bend and extend. Okay.
mhm,
So pretend this is my pelvic floor. If my pelvic floor is too tight and it can only go from here to here as we need that trampoline recoil and that stretch to happen. So
mhm,
if I can only go to here, I cannot generate as much force to go back up if I need to have some strength to jump or move or run.
mhm,
If I have a nice lengthened pelvic floor and I can stretch my pelvic floor all the way, I can
mhm,
generate more force from here to here.
mhm,
Okay. So it's going from here. This is a tight and weak pelvic floor, only able
mhm,
to generate this much force. This is a lot stronger, a lengthened pelvic floor that can generate more strength.
mhm.
So most people are tight and weak when they
Oh,
have a
wow.
pelvic floor problem.
Mhm.
Okay.
I am not surprised.
Yeah.
In thinking about this conversation, I really came to the realization like that is an area of my body that I don't ever consider. I don't ever think about it. I don't ever think about toning it or getting it fit or taking care of it. But I'm sure when there is a problem in that area, it's a big problem. Like, because that's also one of the most private parts of our body. Um,
Mhm.
and
Yeah,
so that is really good to know. So thank you for that analogy.
totally.
Um, let's kind of pivot towards the male anatomy.
Mhm.
And because this is such an underserved area, right?
Yeah.
Why do you think why do you think that is with guys? Why do you think this is just a place in the area that a body that is not talked about and then underserved?
Totally. Well, so I'll tell you the pelvic floor has kind of there's three main big issues that it needs to work. Why it needs to work well. You need to be able to urinate well, you need to
Hmm.
be able to poop well, and
Hmm.
have, sexual activity, intercourse, whatever.
Hmm.
So those are like the main three areas where people have pelvic floor issues, but those three things are kind of embarrassing to talk about.
Yeah.
Nobody talks about that openly. I'm sure that's even probably more challenging for men who are, you guys are these amazing, strong, firemen, you're saving lives, you're doing so many amazing physical activities. And if you can't get an erection, it's like, well, that's just so demoralizing. And a lot of times people don't understand that the pelvic floor has a lot to do with how you pee, how you poop, and how you have sex.
Yeah.
And so those are the main three embarrassing things that happen that people run into issues with, and they don't know really like who to talk to about it.
Hmm.
Yeah.
And what kind of symptoms manifest in guys for pelvic floor issues?
Yeah. So if we're going to start with talking with urination and peeing issues, a lot of
Hmm.
times it's difficulty emptying. So you
Hmm.
go to pee and you feel like you can't get everything out. And maybe you walk around for a minute and you're like, God, I still have to pee. So you go back to the bathroom, you pee a little bit more. And you're just constantly in the cycle of feeling like you can't get all of your pee out.
Hmm.
That usually goes along with urgency. So feeling like you got to go really quickly.
Hmm.
Um, and frequency. So like going multiple times a day. So those are kind of the main ping issues, is just difficulty fully emptying is, I would say, the most common one.
Mhm,
With the pooping issues, constipation, huge one. So
mhm,
just feeling like you're straining to go, you can't poop, not going every day.
mhm.
Uh, normal bowel movements it kind of varies in the range. It can be anywhere from 3 times a day to every third day.
Oh,
So it's
wow.
quite a variety in normal BMs.
Mhm,
But usually these guys have, difficulty pooping, just
mhm,
feeling like they can't get their poop out and they're constipated.
mhm,
And then sexual dysfunction. So, having good blood supply to the penis is really important for
mhm,
obviously erections and having intercourse.
mhm,
So people will say, yeah, I can't get an erection, or I feel like, I had one guy tell me last week, I just feel like, yeah, even when he was like bending forward, he said, I feel like the blood supply to my penis is being cut off, which is kind of,
mm.
a crazy thing to think about. It's just like
Yeah.
so many crazy things that can happen with our body. But yeah, usually difficulty maintaining an erection, getting an erection.
Mhm,
Sometimes it's pain with these things too. Like the erection feels painful. It
mhm,
hurts to ejaculate.
mhm,
And what I will say with all of those conditions, the most common problem is a pelvic floor that's too tight. Okay.
mhm,
So this is the pelvic floor in men.
mhm,
There's different layers to the pelvic floor. So here we have the pubic bone in the front, and
mhm,
then the tailbone in the back, and then the
mhm.
sit bones out to the sides.
Yeah.
And then this is the anus butthole right here. And so we have some muscles on the outside layer. So this is the layer closest to your skin. Um,
Mhm,
these layers do a lot of kind of like closing activities, closing movements with the muscles.
mhm,
And then we have the deeper layers that are right more underneath it and do more of like the lifting activities. So making sure we have ability to support our bladder, our prostate, the organs that are in our pelvis.
mhm.
Okay. So, but yeah, with all of those conditions, urinary problems, bowel problems, and sexual issues, it's usually pelvic floor that's tight and weak.
Mhm. So let's circle back to ED since that's on the table. Is it smart for guys to consider pelvic floor PT before they try something like Viagra or, medication to fix ED if they are having symptoms?
Totally. I think it's a great first step. Because with a lot of the pelvic floor therapy, we're bringing blood flow into the pelvis, usually typically with like different movements, different exercises. Some of the hands-on treatment we're doing is we're bringing blood flow into that pelvic cavity, which usually helps bringing blood flow into the penis and allowing that erection to happen. So, a lot of the medications out there really work on the circulatory and cardiac systems.
Mhm,
Um, but we're kind of approaching it from a musculoskeletal standpoint. Just how can we get you to have better hip flexibility? How can we have you get better spinal mobility? Guess what? When you open up those movements better, blood can flow better in your body. And so
mhm,
I find like it's a great first step if you don't want to start with drugs in
mhm,
trying just to address some of your physical impairments with, I mean, how pretty much every one of these guys has incredibly tight hamstrings, incredibly tight hips, and a really
mhm.
tight back.
Yeah.
Even though they're strong, you have, amazing thigh strength and glute strength. Um, their joints are usually really tight.
Mhm. The curse of being very muscle bound, yeah, is
Yeah,
you lose that flexibility, for
totally.
sure.
Yep.
And I think that's good too, because like you said, then you have, you can, it sounds like accomplish a lot with just physical therapy and different movements and just increasing that flexibility for fixing ED.
Yeah,
Oh,
we definitely take it as like a full body approach. Like it's not just working on the pelvic floor here.
mhm,
Um, you have muscles out here, especially these guys. These guys actually attach to the hip joint.
mhm,
So if your hips are super tight, guess what? Your pelvic floor is going to be really tight too.
mhm.
So I'm working on hip flexibility with pretty much every single one of my guys. Um,
Oh, okay. Interesting.
yep.
Reminds me of that song, the hip bone's connected to the leg bone. Like
Oh, 100%.
we forget that we are a whole creature, and often when we have issues, it's just we fixate, yeah, on that
Yeah.
area.
We have to look outside the pelvis too. So I look up into the chest cavity, the rib cage, sometimes even the neck. And then I
Okay.
look below the pelvis too. I'm like, okay, yeah, hip joint for sure, knees
Hmm.
and feet as well to see like what's going on there.
Hmm.
You know, we have to get these guys, I have them go through like squats and deadlifts and other movements because those are functional movements you're doing for your job as
Hmm.
especially like first responders and firefighters.
Hmm.
Um, you need flexibility through those movements too. You can't just hammer the strength.
Hmm. Exactly.
Mhm.
Um, and I find flexibility routines are something that haven't quite infiltrated the fire service. Like there's some resources for that. But yeah, we're getting there in terms of flexibility and what to actually do for that. Because I think it's easy to know, oh yeah, like to get stronger, I lift weights. But really, what do I do to become more flexible and to really increase blood flow in my muscles? That's a kind of a big question mark for most of us. Um,
Totally.
so how do we I want to circle to back pain. I heard you mention it there because back pain is one of the common issues that firefighters have. Um,
Mhm.
how would you distinguish it, just a normal kind of strain from the job, that kind of back pain from back pain that maybe could be related to the pelvic floor? Is there a way to tell, in the symptoms?
Yeah, that's a really good question. And I will tell you, a lot of people will come into my clinic initially just reporting I have back pain or I have hip pain and not really telling us on the phone they have like a pelvic floor problem. Because we
Hmm.
we are a physical therapy clinic that sees other things as well.
Hmm.
But because I'm a pelvic physical therapist, I'm always going to ask them about it.
Hmm.
And the main reason being, like, so I already told you about this muscle in the pelvic floor that connects out to the hip. Okay, so there's
Hmm.
that guy. But here is your backside. So here's your butt, here's your tailbone, here's your sacrum, here's your low back. So you have those muscles in your back that come all the way down. They're like little train tracks coming
Hmm.
down, connecting into your sacrum here. And they actually kind of blend in with the pelvic floor quite often.
Hmm. Okay.
So a big, you know, not red flag, but a big warning sign is if you have pelvic floor dysfunction is if you tell me you have one of those urinary issues, a bowel issue, or sexual issue, along with back pain, I'm going to be treating the back and the pelvic floor.
Hmm.
So
Yeah.
that's usually a big key for me to, let's dive into the pelvic floor too. But if I start treating the back, maybe I'm doing some more hands-on manual treatment techniques. I do a lot of dry needling as well, which we're allowed to do here in Colorado. It's
Hmm.
an amazing treatment for low back pain. I do it almost every day on folks. But we're really getting these muscles to loosen up and let go. But if I'm really focusing on the back treatment and we're not seeing relief from that, I got to look somewhere else. I got to look into the pelvic floor, or I got to look above it into the rib cage too.
Hmm.
Um,
How
so
is dry needling different or similar to acupuncture? What's
yeah.
I'm not as familiar
So
with it.
dry needling is a very thin needle. The needles are basically similar to acupuncture needles. There's all different sizes and lengths to them.
Hmm.
Um, but we're as physical therapists, we do dry needling to really target a tight muscle or a muscle knot in your body.
Okay.
Acupuncture might put the needle in an area of the body that is associated with ancient Chinese medicine and like meridian lines and the flow of qi.
Hmm.
So they might needle your feet for your back, or
Hmm.
your ears or for your back too. So we're looking just at a musculoskeletal standpoint. It's like, okay, if I go in here and palpate these muscles, and wow, that feels like a little knot, like a little trigger point in there. And oh, that's giving you some of that back pain. Okay. Is it okay if I dry needle that muscle today? And let's see if that relieves it. So I can do
Hmm.
some tests, needle, and then retest again to see if, were you able to now bend forward and touch your toes after I needled that muscle? Or can you now, raise your leg without any pain?
Hmm.
Different things like that. But uh, it's a very effective technique because we're going directly into the muscle knot to release it.
Okay, so it's about releasing tension, or also is it about increasing blood flow, or
Both. So,
okay.
with the research they've done on dry needling, it
Hmm.
releases tension in the muscle. It
Hmm.
does bring in better blood flow,
Mhm.
And so after I put the needles in, they sit in there and
Mhm.
I hook it up to little like jumper cables, which are electrical stimulation.
Uh-huh.
And so you have some jumper cables, that's exactly what they look like. I'll show you
Mhm.
here. But yeah, they're just like little
Mhm.
jumper cables.
Literally, yeah.
Literally, it looks like jumper cables. So what we want to do is stimulate the nervous system with the
Mhm.
muscular system. So by putting some electrical stimulation in there, we'll get a little bit of tapping of the muscles. I'll actually see some muscles contracting, and that tells the nerves to work better, to connect to the muscle better,
Mhm.
because it's a whole system that needs to work in harmony for you to, get out of pain and get strong.
Mhm.
Um, so that's kind of the whole spiel about dry needling.
Wow. Yes, I have never experienced it. So thank you for thanks for
I
diving
would
deeper
love
in.
to give you a treatment and see if you like it.
Oh goodness. I was always fine with starting IVs in people, but when it comes to needles in my own body, I am a big
Pass.
chicken.
Yeah.
So, but thank you for that offer. Um,
Yeah.
so what can guys do to keep this area of their body healthy? Like what can they do? Are there any tips or tricks that you have when you send your patients off, like to keep them well in their pelvic floor?
Are you saying like after we've gone through a course of pelvic therapy, like what keeps them from coming back in? Um,
Yeah.
so kind of how it works is like when you're in for physical therapy, I see it as like a 3-phase approach. So like phase one is getting you out of pain. Most likely people are having some pain in their pelvis with some of those like peeing and pooping symptoms or sexual symptoms. And
Hmm.
so it's like, okay, let's try to focus on if something's causing you pain or you're really limited in that movement in this first phase. Maybe
Hmm.
we're trying needling, maybe we're doing some hands-on work. I also should probably talk about internal work that we do as pelvic physical therapists that involves releasing the pelvic floor muscles from the inside out.
Hmm.
That is a very common treatment I do that is very effective in releasing pelvic floor tension too. Um, so that's done usually kind of that first phase. Second phase is starting to train the muscles to work better, whether that be, okay, let's go over your squat form, your deadlift form. What's your core strength like? A lot of these guys actually don't have the best core strength too. So you need to make sure all those muscles are working together well, along with the pelvic floor.
Hmm.
And then let's load you up. Let's do some barbell work. Let's lift kettlebells. Let's do some deep squats. Let's do deep lunges. Like everything like more weighted for what
Hmm.
you need to do for your profession and lift
Hmm.
heavy stuff.
Hmm.
So then once someone can lift heavy and then they're keeping up with their flexibility and mobility, I'm sending them with a home exercise program. Okay, let's make a couple of these stretches a part of your daily routine. Every morning, I want you to do like these 2 or 3 stretches. It'll take 5 minutes,
Hmm.
just to keep your joints healthy, your hips healthy, your pelvis healthy. And then let's talk about strength training like 3 days a week, focusing on good glute strength, good deadlift form, good squat mechanics, some of those big functional things you need to do as a firefighter. So
Hmm.
it's just staying consistent with the last phase that we work on and making sure you're not just like, oh, I'm fixed, I don't have to do anything else the rest of my life. It's like, well, you got yourself in this position for a reason. If you're
Hmm.
still wanting to go back to um, doing the full capabilities that your job entails, like we need to make sure we're still maintaining a good exercise program and a good mobility program too.
Hmm. That sounds pretty, based on firefighters' normal workout routines, that physical fitness is normally part of what they're doing a lot,
Yeah.
that it would be pretty easy for them to integrate, just into what they're already doing.
Yeah, probably the hardest part would be like keeping up with the mobility work and making
Hmm.
sure we're still, going through good hip mobility, good
Hmm.
spinal mobility stuff, because that's really important too.
Hmm. Can you do mobility and strength training on the same day, or is that something you really need to take as an isolated exercise, is mobility and
No, you could
flexibility?
definitely do it on the same day. I would start with the mobility work, basically like dynamic stretching, where you're not just holding a stretch, you're not just holding a hamstring stretch for like 30 seconds, but
Hmm.
we're doing different like hip rotation movements. We're rotating in and out of our hips, or we're
Hmm.
going into lunges and then coming back out of the lunge, or There's all
Mhm.
sorts of things you can do that is movement based, dynamic stretching before you go and lift too. So that's
Mhm.
dynamic stretching you can do every day, and
Mhm.
then for sure before you lift.
Mhm. Great. Is there anything else that you want men to know about their pelvic floors before maybe we switch into female pelvic floor health?
So I would say, I kind of briefly touched on the aspect of our treatment and care that is internal work. And so
Mhm.
this is where some of the guys are like, okay, what, you're gonna put your finger in my butthole? And literally a guy said that to me on Monday. And
Mhm.
I was like, well, listen, this is what I'm looking for. And that's why I
Mhm.
have this little paper model with a hole in it.
Mhm.
Because I'm not just in there to poke around. I'm
Mhm.
going in and finding a muscle that is the problem muscle to your problem. And
Mhm.
so I need to go in and assess, and I know exactly like what muscle I'm pushing based
Mhm.
on where I'm at in the body. And so uh,
Mhm.
everything it's very sanitary. I'm wearing gloves, using a ton of lubrication. um
Mhm.
Usually if you've had like an exam by like a colorectal doctor or like a prostate exam, it's really not too bad. Just my fingers are small, guys, like they're not um so usually, after the first time, it's maybe lasts about 5 minutes as I'm going in and just feeling, okay, is this the muscle that feels like your pain? Is this the muscle that feels like it's shooting pain into your testicles?
Mhm.
Um, and really, I'm getting good information to get rid of that tension in the muscle so we can progress and move on to the strengthening stuff. And so,
Mhm.
um, another thing I want to say too is I didn't really talk a ton about like testicular pain. I see
Mhm.
this all the time with guys thinking they have a twisted testicle or testicular cancer. There's all these like worst case scenarios going around, and like a lot of times their doctor can't really find like a medical reason for this pain. You definitely need to come see someone like me, a pelvic physical therapist,
Mhm.
because we understand how things are connected in the body. And another crazy thing that a lot of people don't know about anatomy is that your abdominal wall, so the muscles in your abs, which are right here, they
Mhm.
come down and they blend in with your testicles. So a
Mhm.
lot of times I can work on testicular pain by working on your abdomen and getting your ab muscles to release a little bit better and not be so like tense and tight and crunched. A
Wow.
lot of times working on one side of the body can release tension in another side of the body too.
Mhm.
So that's a big thing I see a lot of time where guys will be like, oh, I pushed on this ab muscle, and they're like, that just shot down to my balls. What the hell? And
Mhm.
so it's crazy how all that stuff is connected.
Mhm. Would you also say most people have tense and weak abdomens as well?
Yeah, we all are so stressed out. We're all like clenching and gripping our abs. We're just
Mhm.
trying to meet this aesthetic. Obviously, like as firemen and women, you have to be super strong and you're probably focusing a lot on this area. But
Mhm.
what turns into a problem is when we create too much tension and we can't let the abs relax and fully just go through that full length. If we're always in this tightened and grippy state, guess what's
Mhm.
going to happen to our pelvic floor down here? This is going to tighten up, and our pelvic floor is going to tighten up in response to that too. So it's kind of like this little cycle that happens that we need
Mhm.
to like actually like stretch our abs out and not just do like a gazillion sit-ups every day. Let's do some mobility work too.
I remember being a fat little girl and I started like just sucking my abdomen in. Like that was something from a young age I always did because, like you said, aesthetically, like I didn't want my little tummy poking
Yeah.
out. And I think a lot of these little habits, especially around our core, because it's a very self-conscious area in a lot of ways, and we all do that even as adults. We've maintained some of these
Oh
bad
yeah, it
habits.
sticks with us as adults because then I have to kind of debunk that myth for people. Like
Hmm.
I was like, well, you're not using your abs the right way. Like you're gripping everything up here, tensing
Hmm.
everything up here, but you're not working things below that are closer to your pelvis. You're not working your lower abs. Um,
Mm-hmm.
but yeah, that's a big problem, especially for a lot of women, is like we're always sucking it in. We're trying to maintain that physique and that image. And
Mm-hmm.
a lot of women share that information with me, and I tell them, that's completely common. Like a lot of people say that to me, and
Mm-hmm.
it's something that we have to kind of work through, but also just tell yourself to just let your belly go. Like we don't need to suck it in anymore. We can just breathe and let our abs go.
Mm-hmm.
Mhm.
Well, it's a great transition then to talking about women's pelvic floor health. What do the ladies need to know if you were kind of to give that same good advice to them? Maybe common problems you see, or what do women really need to focus on in their pelvic floor health?
Yeah. So I think with the pelvic floor health, it really starts to come into play if you have had a child, or you've been pregnant and gone through childbirth, is
Mm-hmm.
when I think a woman really first probably thinks about it.
Mm-hmm.
Um, but we see women have never had children that have pelvic floor issues as well. So that's one thing to really think about, is you can have an issue with your pelvic floor and have never have carried a child or birthed a child.
Mm-hmm.
Um, so again, a lot of it comes down to urinary problems, bowel issues, and sexual issues. So with
Mm-hmm.
urination with women, it's leaking is the biggest one, or leaking with coughing, laughing, sneezing, jumping,
Mm-hmm.
picking up our kids, lifting heavy stuff at work. We're
Mm-hmm.
leaking. And with just our anatomy is a little bit different with how long our urethra is. When our bladder sits basically right on top of this pelvic floor. Let me see if you can see that. So that's our bladder.
Mm-hmm.
It's literally hanging out right on top of your pelvic floor. So the
Mm-hmm.
little tube that goes from your bladder to where your pee comes out is short. Obviously,
Mm-hmm.
in guys, it's a lot longer, and it has to go up a little curve and go down into the penis. And so guys don't leak as much, but guys can leak too. So leaking is a huge one. I would say the main number one problem that people will call us to have us try to fix for them. And then leakage with feeling like the urge is coming. So like, I gotta go pee now. All of a sudden you just hit with this big wave of urgency, like you gotta go.
Mm-hmm.
You run to the toilet and you pee on the way. So sometimes that's a situation too.
Mm-hmm.
Um, Bowel issues, constipation, a big one. Even like fecal incontinence too. Sometimes after childbirth, we have a lot of tearing in our pelvic floor,
Mm-hmm.
especially in this perineum area that goes between our vagina and our anus. And so sometimes we can have leakage in bowel stuff or smearing,
Mm-hmm.
um, constipation. And then yeah, sexual dysfunction. So probably the biggest issue is pain with intercourse. So
Yeah.
again, you think about this tight pelvic floor muscle in here,
Mm-hmm.
and you're having penetrative intercourse, and something is pushing against this tight muscle, and it hurts. And so
Mm-hmm.
usually pain with intercourse can be issues with tightness on the outside muscles. Like you're hitting a wall, nothing's able to get through that, or a lot of tension and pain with a deeper penetration too. So
Mm-hmm.
those are the big ones.
Would you say that um, do you find that women also have the same issues with mobility and flexibility, that they also unfortunately neglect, strengthening and staying flexible in their pelvic floor as well?
Yeah, that kind of too tight situation and weakness is probably the most common pelvic floor problem. I would
Mm-hmm.
say women, they're a little bit more flexible in their spine and their hips.
Mm-hmm.
But a lot of them have a lot of like hip tightness, or like even though they're flexible in their hips, sometimes it still feels pinchy, like the ball of the hip joint's just not rolling nicely because of tightness in muscles.
Mm-hmm.
Um, so maybe they don't present physically with a ton of the limited movement like guys would,
Mm-hmm.
um, but they can definitely have back pain, hip pain, and tightness in those areas. But in terms of the pelvic floor in general, that pelvic floor, especially even in postpartum, people will tell me like, "Oh, my pelvic floor is so weak. I'm peeing everywhere. I had a
Mm-hmm.
baby 6 months ago," and then I go to examine. I kind of warn them ahead of time. It's like, I don't think you're just weak. I think you probably have a lot of tension and tightness in here. Because
Mhm.
guess what? This hole in your pelvic floor was 10 centimeters wide. Your
Yeah.
body and your pelvic floor is trying to close that hole back up. And
Mhm.
it's trying to just tense up and tighten again. And so a
Mhm.
lot of times it's not flexible anymore. So your body's trying to
Mhm.
heal itself. It's going to be tight and weak.
Yeah.
So it's probably the most common thing we see.
Yeah. And what was it about kind of what you experienced postpartum that really inspired you to start helping others in this area of their body?
Yeah. So I had my first child in 2016. I'd been a physical therapist already for some years, and I went into my pregnancy feeling good, and I had my baby, really no complications. I had a little bit of maybe a little bit of tearing, and but all was well.
Mhm.
But I started to develop low back pain that really didn't resolve with my typical regular PT activity. So when I had some colleagues work on me, on my back specifically, nothing was really improving. So at 6 months postpartum, I decided to explore the world of pelvic floor therapy, took my first pelvic floor course, and lo and behold, they went and touched some of these muscles inside and went out
Mhm.
here, and then that pain shot up into my back.
Oh,
And
wow.
so I know for in my body what it feels like to have back pain related to your pelvic floor.
Mhm.
So able to get rid of that and treat that out. And then I had my next child in 2017. So I had two kids back to back.
Mhm.
Um, and I think I got pregnant at like 10 months postpartum. So I really wasn't as strong as I could have been.
Mhm.
And then had more back pain in that pregnancy, got through it, whatever, had a nice healthy baby. But then I started to experience uh, prolapse, which is a condition where part of that vaginal wall starts to drop down a bit. I
Mhm.
experienced bladder leakage and still some of that back pain. So I had more things to tease out and work through. I
Mhm.
sought my own physical therapy friends to help out and did a lot of my own work as well. So yeah, I kind of know what a lot of these things feel like, and I know it's no fun, especially if you're trying to handle all the motherly duties and, breastfeed your baby and, make sure they're sleeping the right way and, while you're just peeing your pants and it's just a mess. So,
Mhm.
but I'm here to help. I feel confident in being able to fix a lot of these things, and especially because I went through them myself and I know what it's like. So,
Mhm.
yeah.
Um, Thank you for that vulnerability. I really appreciate you sharing with us your journey, and I am amazed by your dedication. I mean, just the intimacy with which you interact with your patients, and this is not only for them but for you too to manipulate their body in ways takes a lot of trust. And so, yeah, thank you for what you do. You are you're a
Yeah, of
champion,
course.
Dr.
Of course.
Andrea.
Yeah.
um, And is there anything we haven't covered or touch on that you want to highlight or just get the message out about that's really important about this area of our bodies?
I would say the biggest thing is don't let a doctor, another health professional dismiss you if you think something's wrong.
Mhm.
Um, I hear the stories all the time just because, that's just the kind of people that come in here in terms of they're pregnant and they went to their doctor, they're having horrible back pain and they're leaking, and the doctor says, well, you're 30 weeks pregnant, just wait until the baby's born and then it'll just go away.
Mhm.
That is completely false. Like there is so many things we can do, especially in terms of that pregnancy world, to help someone experiencing um, pelvic floor and back pain issues, and we can definitely fix that stuff before they have their kids. So that
Mhm.
is that is a myth. You can definitely seek out someone like me if you are pregnant and struggling with a lot of pelvic floor issues,
Mhm.
and even other issues in general. Like, I'm sure I don't know what the typical population looks like in terms of female firefighters. Like, are they still doing this job into their late 40s, early 50s? We're talking about menopausal issues then too, and so
Mhm.
that with that stuff comes along like pain with intercourse. The tissues are starting to get a little bit tighter. You lose estrogen as we start to go through menopause. So
Mhm.
people start to say it hurts to have sex, or they're just having pain in their pelvic floor area, or they're just having joint pain in general. And so, you know, rather than your doctor just saying, well, it's just menopause, just have fun with that and go about your, you know, life and still try to do your job as a firefighter. You know, that's not true. You can see someone like me to help you out with those sort of things too. I would say, like, in the female world, you know, I think we tend to get dismissed a lot more easily with our reports of pain and what's going on with the body or what we think is going on with our body. So, you know, we're very trained to screen things too. Like, if I think something's wrong and I want you to get like an MRI or something like that, I'll tell you that and have you go back to your doctor. Like, I'm not just gonna keep doing what I'm doing if I feel like something is truly wrong. And unfortunately, I have done that, and a couple of people have ended up having cancer. And so,
Oh, wow.
you know, I've caught things like that too in my career. So, but if you feel like, you know, it's a movement problem. It's a problem when I move my body this way, or any of those peeing, pooping, sexual issues, you can definitely see someone like myself. And in Colorado, we're a direct access state, so you can go see a physical therapist without having to see your doctor first too. So that's you know, a big win where you just don't have to deal with that extra appointment. You just come on and see us. And then I can just obviously let you know what I think, what would help.
That's awesome.
I think those are kind of the big ones. It's like, don't let your doctors dismiss your pain. You know, go see someone like us to truly don't just take a bunch of pain pills and think, you know, that's going to solve your issue. That's just a little Band-Aid on a bullet hole. We got to actually truly fix the root cause.
Yes, I'm a huge believer in physical therapy and how powerful it can be. I had a similar experience where I had a slap tear in my shoulder, and they were advocating surgery, and I was around 35, and they said, well, you know, you may have limited mobility. And I just said, you know, before surgery, I think I'm just going to go to PT first. And I mean, it's amazing for potentially, I mean, I haven't had a scan, you know, post injury. I had a diagnostic one, and I'm with PT. I'm still like, I was just back to normal. I was lifting, you know, 80 pounds, and it's just incredible. I think when you work with like you said, the musculoskeletal system first, the things that you can accomplish is really incredible. Where, yes, other people might be advocating to go right in, do surgery, do whatever, take drugs. I think physical therapy is a great first line of defense. So,
100%.
But will you, as we kind of start to wrap things up, I wanted to leave our viewers with a tool or resource that they can walk away from this conversation with and build their knowledge base. So do you have something you would like to show us to check off that box?
Yes. And so one of the things you can do, this is great for any pelvic floor problem, whether you're a man or a woman, it's diaphragm breathing. So our diaphragm is kind of like we were touching on that question in the beginning. It's like the little roof on your abdominal cavity. So, you know, my diaphragm sits right here under my rib cage. The diaphragm and the pelvic floor work together with breath. And so we can influence the pelvic floor just by starting with diaphragm breathing. I always want someone to have nice rib cage mobility if I'm working on their pelvic floor. Again, like, everything is connected to everything. And so we have to make sure that diaphragm moves well if our pelvic floor is going to move well. So I'm going to teach you how to diaphragm breathe. And so what I want you to do is take your hands and feel into your ribs, kind of at the lowest part of your rib cage here. Okay. And so your diaphragm is a big, like, umbrella muscle that connects to your ribs and kind of goes up and inside you as well. The diaphragm is basically like cuts you in half here. And so when we do this diaphragm breathing, we want to make sure we're breathing into this space, the space in our lower ribs. We're not doing too much breath up in the chest. Okay. So we're going to take an inhale breath for 3 seconds, and my ribs are going to go wide. And then I'm going to just let that exhale. And I'm going to breathe again.
Mhm.
And exhale. So it's really important to have this movement down here.
Mhm.
What this should not look like is, again, this breathing up into your chest, or just your belly going out and in. It shouldn't be that, belly out and in. You should think about the rib cage here being 360 degrees of movement. So it's going to expand wide and then close back in. Okay. You can do this lying down. I recommend that. Spend about 5 minutes and just breathing. It's a great way to end your day or like a stressful shift. Just lie on your back and put your hands on your ribs and practice this diaphragm breathing. And, you know, it's a great time to think about mindfulness or prayer or whatever you want like to do with that stuff too. Yeah.
Excellent. Yeah. So that essentially is to help your pelvic floor, as well as just good old best way to breathe.
Yeah, and I'm sure like a lot of your people have lung issues as firemen. So, I mean, if you're not doing diaphragm breathing now, like please everyone start, because it's just going to be amazing exercise for your lungs, and it's going to calm down your nervous system. It helps stimulate our vagus nerve, which is our calming nerve in our body. And again, like I mentioned, that pelvic floor relaxation, because remember, most people are too tight and weak. We need to bring in length in that pelvic floor first by breathing and stretching. So,
great. Yeah. That is a great tool. Thank you so much for teaching us that. I know it really helped, despite I've been told, you know, breathe with your diaphragm. It really helped, I think, feeling for your ribs and guiding yourself as we do that. So thank you.
Totally.
Awesome. And I also hear that you have a lot of helpful videos on your Instagram page, right? For Movement Physio and Wellness.
Yeah, so we're pretty active on Instagram. We have a lot of like healthy tips. So we'll just post different blurbs about, you know, top tips for this, top tips for that. And we also have some videos on there. So the handle is at Movement Physio CO. And you can find us there. And my team, we usually try to post about once a day. And then I have a website, www.movementphysioco.com. And you're going to find a little bit more specific information about different conditions. There's a male pelvic floor page. You can always sign up for a free consult too. We do phone consults, and we are doing in-person consults right now too. So if you're local to Arvada or Denver, you can come in and do a 30-minute assessment with one of my therapists. And a lot of it's just talking to see, like, is this going to be appropriate for me? You can tell us whatever you're comfortable with. We might, you know, see how you move a little bit. It's not a big full examination, but it's just understanding what this is and if this is going to be appropriate for you too. So you can head to my website to check those out if that's something you're interested in.
Great. Those are all excellent resources, and we will link them below in the show notes if you want to check any of those out after you've watched this. And thank you so much, Dr. Andrea, for joining us today. I loved your learning aids as well. Thank you for bringing.
I know, I always got my visual aids. But yeah, I think the biggest thing, I love doing these talks just because I want everyone to know that this is a thing and they can get help with it. Because I think that's a big thing a lot of people say after coming here, like, oh my gosh, I had no idea this was a thing, and like I could get this fixed, and for men and women too. So just spread the word.
Yes, thank you. We will definitely spread the word. And thank you again to all our community members for watching. If you still made it with us this far, you're a rock star. And as always, we're open to your feedback after the show. If you need to reach out with questions or just want to tell us what you thought, you can always email me at info@firepowerx.com. And again, thank you again, Dr. Andrea, and we will catch you on the next episode. Bye for now.
Bye.